Ovarian cysts. Today we'll be talking about how to treat ovarian cysts. Okay, but before we get to how to treat ovarian cysts, you need to know what causes ovarian cysts, types of ovarian cysts. Ovarian cyst means fluid or that are in the ovaries. Okay, the ovary has like a sac that has food filled in it, maybe like semi-solid. Okay, like water. It's like when something you had a burn. Okay, maybe cold water, hot water burn. That thing that looks like there's water on top of. That's how cyst, ovarian cyst is. So there is fluid filled sac in your ovary. Okay, so these things are called cysts. Now, it is very important to know that most at times cysts, almost some women has cysts, not all, but most at times cysts is not really a problem. Okay, sometimes it goes on its own. Okay, and most women may have cysts in at one point in their life, and it will just go. Now, the only issue is the type of cyst that you have, which is when the treatment will come in. Okay, so these are cysts. Now let's talk about what causes cysts. Now, hormonal imbalance can cause cysts. Endometriosis can cause cysts. Pelvic inflammatory diseases, infection can cause yeast. Gonorrhea can cause yeast. Untreated sexually transmitted infection can cause ovarian cysts. So this is why you should be very careful. And then taking this induced clomiphene, this induced pregnancy ovulation inducer can cause yeast. So this is why I tell people because for people wanting to get pregnant, I have it with twins. The videos I make, you can watch the video on how to get pregnant with twins. I tell people that you don't take those drugs on your own. Let it be prescribed by your doctor who knows your history, knows if you have cysts, the kind of cysts you have, if they are hemorrhaging, and to monitor you, because these drugs can make you have cysts when you don't have cysts. Okay, another cause of ovarian cyst is having your ovulation. Sometimes when you have ovulation, it comes hyper ovulation and then it disappears on its own. So please, it's very important to know that before you take all those drugs that induces ovulation, you will have to make sure your gynecologist prescribed it and monitors you. And don't take the same drugs that your friend is taking. They tell you they take a drug and the drugs they took work for them. It made them taking. You don't know their health history. You don't know if you're the same with them, and you go and take the same drugs. You see, you're endangering yourself. You might have cysts, and probably your cyst is not bleeding. It will now start bleeding, and then taking all of these hot herbal drugs, herbal mixtures mixed with different things. Please, this may hurt your cyst. It will make it grow bigger or burst or become hemorrhagic, that it starts bleeding. So please be careful of any herbal things that you take. Okay, so having known the causes of yeast, let's talk about the types of yeast. I won't dwell much on that. This will help us when we're talking about treatment of yeast of ovarian cysts. The type of yeast, cyst, there are some cysts that are normal. For instance, the functional cyst. Okay, not really normal, but it goes. What I mean by normal is that it goes on its own. It resolves on its own. Probably you don't even know. Maybe when you went to do scan, they will find out that you have cysts, and later it will just dissolve on its own. So it's not really a problem. Now there are some cysts. Another kind in that functional cysts, there are other types, but let's not dwell in it. The other type of cysts are now those ones that are gives you issues. There are cysts that are hemorrhagic. The cyst will now burst and start bleeding. Now there are endometriosis cysts. Okay, when the endometriosis causes ovarian cyst for you. Now there are cysts that are caused by polycystic ovarian syndrome. It becomes multiple. If you have PCOS, I had an interview with a gynecologist. Please go and watch the video. Okay, about PCOS here on the playlist of the women's playlist. Okay, so these are types of cysts. There are also dermoid cysts. Okay, there are cancerous cysts. Okay, yeah, ovarian cancerous cyst. So you need to be sure and certain on the kind of cyst you have. When your doctor tells you, is diagnoses you of cyst, find out the kind of cyst you have. So properly, let's go to treatment or cure of yeast. Now, like I said, yeast is not why do I keep saying yeast? Ovarian cyst is not really a problem. Some dissolve on its own, while some are a serious issue and can be life-threatening. Now, in the treatment of ovarian cyst, there are two things that you need to know. When your doctor tells you that you have ovarian cysts, you need to find, number one, you need to find out the size of the cyst. Number two, you need to find out the kind of cyst that you have. These two things will determine your management and how to treat that cyst. Now, there are cysts that dissolves on their own, and there are cysts that will not cause problems for you. There are cysts that it has to be surgically removed, which brings us to the number one management is surgery. It is not a very huge one. Cysts that are more than 5 centimeters has to be surgically removed. If not, it will, start pressing on some organs and start causing problems for you. Okay, but cysts that are lesser can be managed. Either they drain it, there's a way they can drain it out, or it depends on now the type of cyst you're having. If it is the one that can resolve on its own, your doctor will know and monitor you. Okay, now the second thing is, if the type of yeast you have, if it is hemorrhagic cyst, this means when your cyst bursts and then start bleeding. This brings you to bleeding even when you're not on your period, heavy bleeding. So you see, when you're bleeding, when your cyst is hemorrhagic, something needs to be done about it. Okay, so this is also in the terms of surgery and with your doctor's discretion. So if you're having hemorrhagic cyst, or you've been told you have ovarian cyst, let them ask the type of cyst you have and what is the size of my cyst and what can be done. Please be aware. Now, the next one that you should note in the treatment of yeast of cyst is, cysts can actually be treated with mere antibiotics. Yes, most cysts are caused by pelvic inflammatory diseases. Most cysts are caused by infection. So what the doctor needs to do is to treat the infection, treat you, and you will be better. This is why you should not try to treat yourself. Don't do self-medication. There are different ways antibiotics will be mixed together. There are some courses of antibiotics they give you this one and then mix it with another type, another classes. I don't want to be mentioning names, cephalosporins, based on their discretion, and then monitor you. So it now depends on what is causing your ovarian cyst for you. So this is very important to understand what kind of cyst you have. Now, please, I forgot to mention on the signs and symptoms that may suggest that you're having cyst. Now, most people do not know that they have cysts, because most at times you may not have signs and symptoms, just like it comes during your ovulation or maybe induced by drugs. So most at times nothing happens, it comes and it goes on its own, okay, when you are about to ovulate. But most of the time, some people don't even know, except when they are doing scan for something and they find out that they have cysts. But if you're having these things, this may suggest that you're having cysts. Number one, you're having back pain. You're having fullness at the back. It's as if your back is full, like kind of your abdomen is full, okay? You're having pain. You're having painful sex, okay? Please, I have a video on painful sex in women, causes and management. Please, you can locate it here on the women's playlist. So please note these things. These are the suggestive signs, and serious back pain, serious pain, and pelvic pains. Okay, please, if you're noticing any of these signs, not only could it be a cyst, it could be another health issue. Please make sure you see a gynecologist. Okay, so that is all about it. If you're having issues calculating your ovulation, I have videos here. Let me know if you have more questions. And we are still expecting the gynecologist, and I'm still expecting your questions that we will send to him so that he can come on live and lecture all of us. I hope this video made you happy. Like and subscribe. Put on your notification button so that when I make new videos, you will get to see them. Have a lovely day.